Rain tapped gently against the windows of the city hospital. The corridors buzzed with their usual rhythm, nurses rushing with trays of medicine, doctors exchanging hurried words about diagnoses. Somewhere in the distance, a child cried. Dr. Alexander Petrovich Sokolov walked through the long hallway of the surgical ward, holding the medical file of his next patient. At just 29, he was already respected by colleagues for his steady hands, sharp mind, and above all, his compassion. No matter how critical the situation, his eyes never lost their calm. That gray October day, the hospital's chief physician, Ivan Grigorievich Morozov, summoned Alexander to his office. Morozov was an experienced man, but he had grown wary of the young surgeon's rising influence. Patients requested him by name. Colleagues sought his advice. And that, for the chief, was unsettling. Without lifting his eyes from the paperwork, Morozov spoke. Dr. Sokolov, we've received a complicated case. Mikhail Ivanovich Kuznetsov, 57 years old. Stage 4 stomach cancer. Multiple metastases. Alexander's face remained composed, though he understood what that meant. By all indicators, the operation is hopeless, Morozov continued coldly. But the family insists. They'll pay anything. I've decided to assign this surgery to you. Alexander immediately sensed the trap. A doomed case. If the patient died on the table as expected, his reputation would suffer. Still, he asked calmly, when is the operation scheduled? Tomorrow morning. Prepare everything. That evening, Alexander entered the patient's room. Mikhail lay pale and exhausted, his wife Elena sitting beside him, her tired eyes full of quiet devotion. Doctor, Mikhail said softly, I know my chances are slim, but I want to try. My daughter is getting married in 2 months. My dream is to walk her to the altar. Elena squeezed his hand, then looked at Alexander with silent pleading. We're not asking for a miracle, she whispered. Just a little more time together. Alexander stood in silence for a long moment. In their eyes he saw not fear but courage, the need to know they had done everything possible. I'll do everything in my power, he promised quietly. That night he barely slept. He read journals, consulted distant colleagues, replayed every possible surgical step in his mind. Deep inside, a fragile thought stirred. What if there's still a chance? The next morning, the operating room was unusually crowded. Nurses, residents, even senior doctors had gathered, some out of sympathy, others out of morbid curiosity. The operation began at 9. For the first 2 hours, everything went by the book. Then Alexander reached the tumor. His heart quickened. It was large, yes, but not as hopeless as the scans had suggested. And the metastases were far less extensive than feared. How's the patient? He asked the anesthesiologist. Stable. Pressure normal. Alexander made a decision. He would not operate to defend his reputation, nor to prove Morozov wrong. He would fight for this man's life. The surgery lasted 5 intense hours. With unwavering precision, Alexander removed the diseased tissue millimeter by millimeter. His assistants worked in silence, sensing the gravity of the moment. At last, one of them whispered, Doctor, I think we can remove it all. Alexander didn't answer, but his eyes lit with cautious hope. Another hour passed. The final suture was placed. The operation was over. When Alexander stepped out into the corridor, the family rose to their feet. Elena and her daughter looked at him with trembling anticipation. The operation was successful, Alexander said, removing his mask. We managed to remove the tumor completely. The road ahead will be long recovery chemotherapy, but he now has a real chance. The women burst into tears. Tears of relief, gratitude, and joy. Does that mean, the daughter asked, barely able to speak, that he can walk me down the aisle? Alexander smiled. Yes, I believe he can. Days later, Morozov called Alexander back to his office. This time there was no disdain in his voice, only quiet respect. Sokolov, he admitted, I underestimated you. In modern surgery, the biopsy confirms you removed everything. Impressive work. He paused, then added, but more importantly, I've realized something. It doesn't matter whether a doctor is young or seasoned. What matters is whether he is willing to fight for every patient, right until the end. 2 months later, Mikhail Kuznetsov stood in a small church, weak from treatment but upright, steady and smiling, as he walked his daughter down the aisle. His wife Elena watched from the first row, eyes shining with gratitude. And in the back, unnoticed, stood Dr. Alexander Sokolov. Not as an honored guest, but simply as a man who needed to see with his own eyes that his work had meaning. Watching the family's joy, Alexander understood the truth. In medicine, as in life, miracles do happen. But more often, they are created by those who dare to try, even when the odds are almost zero. Outside, the rain had stopped. Through the clouds, the first rays of sunlight began to break through.